Hello, my name is Makena Mwiti from PCH Ogoria Hospital, from a nutrition department. As we all know, this is the World Breastfeeding Week, where we are supporting breastfeeding for working moms. So we will talk about tips of breastfeeding and also the importance of breastfeeding and supporting moms who are working and also breastfeeding. So for a start, breastfeeding is very vital for both the mother and also the child. For the child, breast milk contains all the nutrients that the baby needs. So for the very first 6 months after birth, the baby doesn't need any other nutrients from food or even water, because breast milk is able to provide everything they need. And also, it contains the antibodies that help prevent illnesses for the babies, whether it's short-term illness or long-term illnesses. For the mother, it also helps the mom and the baby to bond. So the bonding between the mom and the baby is quite easy when the mom is breastfeeding. And also it helps reduce the risk of some illnesses for the mom, such as ovarian and also breast cancer. So in a nutshell, those are some of the benefits of breastfeeding for the both mom and the child. So how do we do breastfeeding? So for a start, the mom needs to ensure hygiene, before breastfeeding. So they need to clean their hands with clean water and soap and dry them well. And then after that, mom needs to ensure that they are seated in comfortable position to avoid straining during the breastfeeding period, or also to avoid backaches. Yes, so after you make sure of that, now you need to pick your baby and get rid of the excess clothing, so that there will be a good bonding between the baby's body and also the mom's. After you pick your baby, you need to hold them with this hand holding the baby's bum. Yes, and this hand of the baby is under your armpit, and the head is in this position. Now with the free hand, you pick the breast. Yes, with the 4 fingers under the breast and the thumb supporting the upper part of the breast, and then you position the nipple of the breast inside the baby's mouth, with also the bigger part of the areola or the dark part of the breast inside the baby's mouth, and the chin also should touch the breast. So the baby's mouth should be wide open like this, like the fish mouth, like this, and then you watch the baby breastfeed keenly to avoid choking. So the baby should breastfeed in one breast for like 20 to 30 minutes to allow the baby to reach the head milk, which is the father milk that contains all the nutrients. So after the baby has breastfed in one breast for 20 to 30 minutes, they can pull off the breast themselves. That means they are full. Or if they are not full and they are finished, the mom can feel the breast is now softer and most of the milk is gone. So you feel the breast is somehow soft and most of the milk is gone. So you can turn the baby to the other breast, okay? Like that, and then they will continue breastfeeding in the other breast. When the baby is done breastfeeding, you need to back them. So you hold them in an upright position. This is one of the way that we use mostly. So you hold them in an upright position like this, and then you sit them on their back. This will allow the baby to back and remove some air maybe that they may have picked when breastfeeding. Yes. So when you're done, the baby might be asleep, so they can sleep. And when they are not asleep, you can also continue playing with them. So this week we are supporting breastfeeding for moms who are working and also breastfeeding. So the moms who are working, they can be able to express the milk and leave it with the caregivers for the baby to be fed. So when the caregiver is giving the milk to the baby, they're supposed to warm it to a temperature that is conducive. And before giving the baby the milk, they need to test the temperature of the milk so that they can give the baby. For the law also allow that the moms, that the employers provide places for moms to breastfeed. So it is okay for the caregiver to bring the babies to the moms for them to breastfeed. Here at PCA Chogoria Hospital Nutrition Clinic, we provide services that address challenges of breastfeeding. So we welcome you to PCA Chogoria Hospital, where we care with love. Thank you.